This video will review the variants and types of nasal cannulas. On the left is a straight prong nasal cannula. The center is a straight prong flared nasal cannula. The flaring at the ends, instead of having a steady straight stream of oxygen, it will disperse it, making it more comfortable for the patient. Although the diameter looks larger on the center cannula, at the base it is the same as the one cannula on the left. On the right is our normal end-tidal nasal cannula. I want to point out that only the left line is the inlet for oxygen. On the right is the CO2 sampling. So only this is allowing oxygen to pass instead of the other two, which have two lines allowing oxygen to pass in. Lastly, look at the diameter of the opening on these oxygen outlets. It's much smaller than it is on these two. The last thing is, I keep saying straight prong. Yes, there are different types. This is a curved prong. The purpose of this is to direct the oxygen flow towards the nasopharynx. Step one is to lower the securing ring all the way. Two is make sure the prongs are facing the right direction. In this case, these are the curved prongs. So we want to paint towards the patient's feet. In the nose, around the ears, a little bit of downward force, and then secure. Next, we'll review two topics related to nasal cannula application for RSI. First, we'll cover nasal cannula application, which will be reviewed again later during the RSI setup/preparation video. And then next, we'll look at a flow rate demonstration between an end-tidal cannula and a non-end-tidal cannula. For RSI, we'll need to place two different nasal cannulas, the non-end-tidal cannula and the end-tidal cannula. The best way to do this is to first place the non-end-tidal cannula. Same way, prongs in, around the ears, traction, securing ring. Then place the end-tidal cannula. Prongs in, around the ears, traction, securing ring. The flange on the end-tidal cannula will prevent the intubation attempt, as it will drag, or the rinscope will drag in the flange into the patient's mouth. So having on top allows for easy removal just prior to the intubation attempt. This will demonstrate the flow rate difference between the normal nasal cannula and the end-tidal nasal cannula. We have two D cylinders with the same regulators. On the left is the end-tidal cannula, on the right is the normal cannula. 2 liters. 4 liters. 6 liters. 8 liters. 10 liters. 15 and 25. Follow up on the two videos that you just watched. For the RSI nasal cannula application video, just want to hit home that only the non-end-tidal cannula will have oxygen flowing through it. The end-tidal cannula is simply to measure if the patient's still breathing and get an end-tidal. For the nasal cannula flow rates video, comparing the end-tidal to the non-end-tidal cannula, just know that this is anecdotal. We're not measuring the actual flow rates. It's looking at bubbles underwater. I do think, though, it is rather compelling. Really a marginal difference in flow visually between the two cannulas below 10 liters a minute. Once you cross that, it's pretty obvious that the normal cannula is delivering a lot more oxygen. This concludes the nasal cannula video.